Hey everyone, welcome back to Crush Medicals. Here on this channel we talk about everything health, and today we're diving deep into a topic that's incredibly important, especially for those of you living in or traveling to areas where it's a concern. Malaria. Malaria is a serious illness, but the good news is it's treatable. We're going to walk through everything you need to know, from recognizing the symptoms to understanding the treatment options and preventive measures you can take. So whether you're just looking to be more informed or you're worried about yourself or someone you know, this video has got you covered. Remember guys, knowledge is power, and when it comes to your health, being informed can make all the difference. So let's get started. Okay, let's tackle the first crucial step: diagnosis. Like with many illnesses, early detection is key for successful malaria treatment. You might have heard of malaria and its association with mosquitoes, and you're right to think about that connection. Malaria is caused by a parasite that's transmitted through the bite of infected mosquitoes. Now, if you get bitten and start experiencing symptoms like fever, chills, sweats, headache, muscle pain, fatigue, nausea, or vomiting, it's time to see a doctor ASAP. Now, it's important to remember that these symptoms can mimic other illnesses, so don't try to self-diagnose. See a healthcare professional. They'll ask about your medical history, travel history, and any potential exposure to mosquitoes. But to confirm it's actually malaria, they'll need to do a blood test. There are a couple of ways they can do this. Microscopy, where they look at your blood under a microscope for the parasite, is the gold standard. It's accurate, but it can take a little time to get the results. The other option is a rapid diagnostic test, which, as the name suggests, is much faster, often giving results in just 15 to 20 minutes. These tests detect specific antigens produced by the malaria parasite in your blood. No matter which test is used, the important thing is getting that diagnosis so you can start treatment right away. Once you're diagnosed, your doctor will determine the best course of treatment based on a few factors. These include the type of malaria parasite you have, the severity of your infection, your age, whether you're pregnant, and any other medical conditions you might have. The good news is we've got a range of effective antimalarial medications to fight this thing. For uncomplicated malaria, which is thankfully the most common type, your doctor will likely prescribe a combination therapy called Artemisinin-based Combination Therapies, or ACTs for short. These ACTs are highly effective at killing the parasites and reducing the chances of the parasite developing resistance to the medication. Now, depending on the specific ACT prescribed, you'll typically take these medications for about 3 days. In some cases, your doctor might prescribe other antimalarial drugs like chloroquine. However, chloroquine resistance is a growing problem in some parts of the world, so it's essential to follow your doctor's instructions and complete the full course of treatment, no matter which medication they prescribe. Now, for severe malaria, which is more serious and can be life-threatening, you'll need to be hospitalized. Treatment typically involves intravenous, IV, antimalarial medications like artemisinin to quickly clear the parasites from your blood. Along with IV meds, you'll also receive supportive care to manage any complications that might arise. Treating malaria isn't just about killing the parasite. It's about supporting your body's natural ability to recover. That's where supportive care comes in, especially for severe cases. If you're hospitalized for malaria, you'll likely be given intravenous fluids to prevent dehydration, which is common with the fever and sweating malaria causes. Electrolyte imbalances can also occur, so these IV fluids often contain electrolytes like sodium and potassium to keep everything in check. In some cases, particularly with severe anemia, low red blood cell count, a blood transfusion might be necessary. This helps restore your blood's ability to carry oxygen throughout your body, aiding in your recovery. Remember, malaria can lead to complications like kidney failure, brain damage, cerebral malaria, and respiratory distress. Close monitoring in a hospital setting allows healthcare professionals to quickly identify and manage these complications, providing life-saving interventions when necessary. Now, wouldn't it be great if we could avoid getting malaria altogether? While we don't have a foolproof method yet, there are some seriously effective preventive measures you can take, especially if you're traveling to or live in an area where malaria is a risk. First up, let's talk about mosquito avoidance. These pesky insects are most active at dawn and dusk, so try to minimize outdoor activities during these times. When you do venture out, cover up. Wear long sleeves, long pants, light-colored clothing, Mosquitoes are attracted to dark colors and use insect repellent containing DEET on exposed skin. But it's not just about what you wear, it's also about where you are. Mosquitoes breed in standing water, so make sure to eliminate any breeding grounds around your home like buckets, flower pots, or clogged gutters. Use mosquito nets over your bed at night and consider treating them with insecticides for added protection. And hey, if you're traveling, talk to your doctor about prophylactic medication, which you take before, during, and after your trip to reduce the risk of infection. Remember, prevention is always better than cure, so be proactive and keep those mosquitoes at bay. All right, let's talk about something super important: patient education. You are your own best advocate when it comes to your health. One of the most crucial things you can do is to take your anti-malarial medication exactly as prescribed. Don't skip doses, even if you start feeling better. Remember that completing the full course of treatment is essential to eliminate the parasite entirely and prevent drug resistance. Be aware of potential side effects from the medication and report any unusual symptoms to your doctor immediately. It's also important to be able to recognize the symptoms of malaria. We talked about them earlier: fever, chills, sweats, headache, muscle aches. You know the drill. If you experience these symptoms, especially if you've recently traveled to a malaria endemic area, seek medical attention promptly. Don't hesitate to ask your doctor questions about your diagnosis, treatment, or anything else that's on your mind. The more you know about malaria, the better equipped you are to protect yourself and your loved ones. Remember, knowledge is power, and when it comes to your health, you deserve to be empowered. So you've been treated for malaria, that's great. But the journey isn't quite over yet. Follow-up care is crucial to ensure you've completely recovered and to catch any potential complications early on. After finishing your anti-malarial medication, your doctor will likely want to see you for a follow-up visit. This is to check your progress, make sure you're feeling better, and address any concerns you might have. They might also order repeat blood tests to confirm that the parasite is completely gone from your system. These tests are usually done a few weeks after you finish treatment. Depending on the type of malaria you had and your overall health, you might need additional follow-up appointments and blood tests over several months. This might seem like a lot, but trust me, it's better to be safe than sorry. Remember, even though malaria can be a serious illness, with prompt diagnosis, appropriate treatment, and proper follow-up care, you can make a full recovery and get back to your awesome self. And that wraps up our deep dive into malaria. It's a complex illness, but I hope this video gave you a good understanding of the diagnosis, treatment, and prevention strategies that can protect you and your loved ones. Remember, this video is for informational purposes only and doesn't substitute for professional medical advice. If you have any health concerns or think you might have malaria, please see a healthcare professional for personalized guidance. Don't forget to subscribe to Crush Medicals for more informative videos like this one, and hit that notification bell so you don't miss out on any future health tips. Until next time, stay healthy, everyone.